Hi everyone, this is Aurelie Najm from Glasgow. I am super excited to report for you on the first day of EULAR in Milan. It's very warm here, so I hope you're more comfortable at home. So I wanted to share with you some quite interesting data of something I hadn't really heard of before. Was the possibility for colchicine to prevent progression of osteoarthritis to total knee or hip replacement. So the abstract number, it was presented at the osteoarthritis session, OP0072. And so it's a post-hoc analysis of a study that, was studying colchicine, but in a totally different indication. In fact, it was in a chronic coronary disease. And this was a randomized controlled trial of over 5,000 patients. It's been published in the New England Journal of Medicine back in 2020. And the idea was to see if low dose of colchicine, so 0.5 milligrams daily, were able to reduce the risk of cardiovascular event. And it was a composite criteria with death, myocardial infarction, stroke, etc. And so what they've been able to show in that original study was that colchicine could reduce the risk of roughly 30%, which is quite a lot. However, the group treated with colchicine had a higher hazard ratio for non-cardiovascular related deaths. Anyways, I think it was just important that I was giving you a tiny bit of background on this, right? So what they did is that they did a post-hoc analysis of that data, and there was a lot of people that were having osteoarthritis. And so what they observed, and it's fairly interesting, is that over a year of treatment, there was a much lower number of patients needing either total knee replacement or total hip replacement. They did combine that. And the risk was also reduced from actually 31%, which is quite impressive. And what they did to make sure they didn't include the people that had gout is that they excluded them from the analysis. So obviously the study was not designed for this, so that's why we can't really draw absolute conclusions. However, I think it's really interesting, that concept that within a year you can reduce that much the progression to total knee or hip replacement. And I think this really warrants further investigation. So I would suggest that you stay tuned, you go online and you connect to rumnow.com for more fresh live content from Milan, and follow me on Twitter at Aurelie Najm.